When looking for a tooth whitening toothpaste, there are several things that we recommend that you look at prior to buying that toothpaste. One is obviously to make sure when you're looking at any sort of toothpaste, you need to make sure that it has the American Dental Association approval. This means that it's been checked and verified that it is valid for what it's supposed to be used for and will not cause or have any ill effects, on the teeth and the gums. So that's kind of important one because there's a lot of toothpastes out there that do not have that ADA seal on it. So it's imperative that you check to make sure the toothpaste does have that seal. Now in terms of the actual whitening, the most active ingredient that we find in any sort of teeth whitening product is peroxide. So one of the first things you should look at is when a toothpaste says that it's actually whitening, I always look on the back of the toothpaste to see whether or not there's any sort of peroxide on the back of the tube. If you find that there's not a peroxide ingredient within the toothpaste, then it's truly not a teeth whitening toothpaste. What ends up happening is a lot of these toothpastes out there that claim to be teeth whitening toothpaste, all they're really doing is they're keeping the teeth clean. And the argument is that the cleaner the teeth are, the more whiter that they will be. While that's certainly good and well, it doesn't truly have any chemically whitening properties. And this is because peroxide is very difficult to find in toothpaste, and it typically is not a long-lasting product. It doesn't have a very good shelf life. So if you're looking for a toothpaste that truly does whiten and doesn't just keep the teeth clean, you need to look for ones that would have peroxide as a formulation within the toothpaste. You really can't contribute to any sort of whitening unless you have the peroxide in there, other than the fact that using regular toothpaste can mechanically keep the teeth clean, furthermore keeping them white. The other thing that should be looked at with whitening toothpaste is to see if they're designed for sensitivity. A lot of people go out and find the first tooth whitening toothpaste they see, and they may have generalized sensitivity to cold and sweets. And we typically find that with whitening toothpaste, it tends to exacerbate any sort of sensitivity that one might have. So if you're one that wants to whiten your teeth and you want to use a toothpaste regimen, you need to check to make sure that it has some sort of sensitivity written on there. Otherwise, you are going to be more prone to developing sensitivity with that toothpaste. But certainly the ADA seal is one important thing to be checking to see if it has peroxide as an active ingredient, but also to see if it has anything designated for treatment of sensitivity. You do not want to use a toothpaste that's a whitening toothpaste if you have sensitivity in your teeth and it does not address the sensitivity. But most of the products on the market are successful in keeping the teeth clean and healthy, but they're not as driven to truly whiten the teeth unless you're looking at it from a physical standpoint.